When it comes to pediatrics, if the child passed the newborn hearing screen after they were born, signs to look for about suspecting a hearing problem would be things like unexplainable fussiness. If the babies are kind of pulling or tugging on their ears, that could indicate a sign of an ear infection or fluid accruing in the middle ear, which can cause a type of hearing problem, temporarily usually, but because of the anatomy of a child, it may not resolve as quickly as it should, like in an adult, and because of that prolonged fluid being there in the ear, it can actually cause some speech delay. For older children who should be starting to talk, if the speech is not sounding very clear, it's hard to understand, not so much for the immediate family, but for those that are not as familiar with the child, those are all good indications that maybe now is a good time to get the hearing checked, see how things are. There's a variety of testing that we can do on little ones. Not every child is going to let us put headphones on them, understandably, because it's kind of a scary thing. But there are different techniques that we can use to still get good information on their hearing ability. A lot of the pediatrician offices now, too, are starting to do hearing screenings on children starting at certain ages. So I've gotten a lot of referrals from kids that just didn't pass the pediatrician screening. But it's never too young to get it checked. I usually start doing sound field testing using putting the child in the booth and watching a fun little video to keep their attention, and then I'll make a sound in the room through the speakers to see if they turn in response to that noise, and then I reinforce that turning by playing a fun little video. I encourage parents to bring in their child's favorite video if they have one, something that will keep their attention long enough. But I usually start that at about 6 months of age. And as the child is older and compliant for this, I'll have them wear either little earphones in the ear or headphones on the head over the ears, and that way be better able to test each ear individually. Starting at about 2.5, I may start to teach the child to do what we call play audiometry, and that's really fun. Parents can get involved with this, but basically when the child hears the tone, they then get to throw a ball into a bucket, or they can stack building blocks and build a little house. I mean, anything to help them tell me when they've heard the sound.